Ventricular septal defects. Introduction. Derived from the neurocrest cells, the endocardial cushion and the septal walls of the heart are the site of most of the congenital defects that occur in the heart. Epidemiology, so the most common congenital heart defect affects about 2 to 7% of live births. Etiology, so it's associated with Edwards syndrome, it's associated with DeGeorge syndrome, with fetal alcohol syndrome, with Down syndrome, and among others. Pathophysiology of ventricular septal defects. So what happens is the defect in the intraventricular septum allows blood to flow between the ventricles, the right and left ventricle. Usually, this is usually from the left to the right because of the higher pressure of the left. So what happens is you have this mixing of the oxygenated blood with the deoxygenated blood before it heads to the pulmonary circuit or circulation. Then what happens is the right ventricle has an overload of blood, or the volume overload, causes the right ventricle to hypertrophy, which causes an increased pulmonary blood flow, which in turn increases the pulmonary artery pressure, causes pulmonary hypertension, and possibly right heart failure. So then you have decreased blood to the left heart because of all this, which causes a decrease in the cardiac output. In the late stages, right ventricular hypertrophy may cause a reversal of the ventricular pressures, reversing the shunting of the blood to the right and left shunt. Pathology. Ventricular septal wall defects, so most commonly seen in the membranous portion of the septum near the AV valves. Clinical presentation, so you have small defects and large defects. With small defects, these will be mild and asymptomatic. You may even have a murmur that's present on a physical exam. Now the large ones, so the congestive heart failure sign may be present for weeks to or even a month after birth. So this could include poor feeding or fatigue during feeding. It can cause diaphoresis, which is abnormal sweating, wheezing, grunting, poor weight gain, frequent respiratory infection, tachypnea, which is abnormal breathing. Now, on the physical exam, you're going to have a harsh, hollow systolic murmur, best heard over the fourth intercostal space at the peristernal border. The murmur is worse with exertion. Moving on to diagnosis, you can use guess what? EKG. Because the EKG is used to confirm this condition and may show the signs of right ventricular hypertrophy.